Hi, I'm Dr. James Latshaw. I'm a shoulder and elbow surgeon at Orthopedic 1, practicing out of the Sawmill and Dublin Road offices. I want to talk to you today about shoulder instability. The shoulder is a ball and socket joint, and it has more range of motion than any other joint in the body. And because of that, it has less stability than any other joint in the body. So dislocations of the shoulder are much more common than any other joint that you have. The socket of the shoulder, if we look at a model, is fairly shallow. There's not a lot of depth to it. As the ball sits in the socket, when there's a dislocation, most of the time it tends to come out towards the front. Usually there's some trauma associated with that and the ball leaves the socket. When that happens, sometimes it'll go back in by itself, but more often people need to be sedated and have the shoulder put back in place. When a shoulder dislocation occurs, there's typically two age groups that these happen in, and the treatments are very different based on those age groups. So for the younger age group, which we would classify somewhere around younger than the age of 25 or so, when the shoulder dislocates, there's a fairly high chance that it will dislocate again. This has to do with the flexibility of the tissues. Their shoulder is nice and flexible, so when it comes out of place, it's likely to do that again. Additionally, when the shoulder dislocates, there's typically damage that happens in the shoulder, usually to two different structures. There's often stretching of the ligaments around the shoulder, as well as a tear in this ring of cartilage called the labrum. The labrum goes all the way around the socket of the shoulder, and it helps add some depth to the socket. And when that's torn, it becomes the equivalent of a golf ball sitting on a golf tee with a little chip out of it. That ball wants to keep rolling towards that side. And so the younger you are when your shoulder comes out of place for the first time, the more likely it is to come out of place again. And often those repeated dislocations require less and less trauma, sometimes to the point where people just roll over in their sleep and the shoulder comes out of place. For those reasons, we will sometimes recommend surgery after a first-time dislocation, but we always recommend surgery after shoulders come out of place more than once. Typically, that surgery involves repairing the labrum as well as tightening those ligaments that have stretched out. That's generally a procedure that can be done arthroscopically with just small incisions around the shoulder. Once it's repaired, all shoulder surgeries typically go through the same type of rehab process where there's a protection phase that happens for a while. So people are in a sling for a period of time, sometimes with some gentle stretching. And that's followed by a rehabilitation phase, work on getting the strength and motion back. And the goal of that operation is to prevent the shoulder from coming out of place again. We know that the more often the shoulder comes out of place, or the more times it comes out of place, the more damage it can be caused. And specifically, if your shoulder comes out of place repeatedly, you're number one, much more likely to get arthritis in that shoulder down the road. But two, is the bone on the socket can start to erode away. So as that ball continues to dislocate out the front, it can start to wear away the bone on the socket. And now we're missing a lot more of that golf tee that we had before. And that can require a much bigger operation where we transfer bone to the front of the socket to make a new socket. And those are the things we're trying to prevent with the surgery. Now in older people, the older you are when your shoulder dislocates for the first time, the good news is it's much less likely to ever dislocate again. The tissues are stiffer and recurrent dislocations are not very common. However, that tissue stiffness tends to lead to other injuries that go along with the dislocation. So older people over the age of 50 or so, when they dislocate their shoulder, are much more likely to tear the rotator cuff or fracture the socket or the arm bone. And our treatments for older people when they dislocate their shoulder are much more directed towards those other associated injuries with it. So typically it would be either repairing the rotator cuff or needing to take care of the fracture. It is much less likely that we would need to do surgery for the dislocation itself unless it were to come out of place. So most older people, if they dislocate their shoulder, and do not get an associated injury with a fracture or a rotator cuff tear, those can typically be treated without surgery. Again, with a protection phase for a period of time with your arm in a sling, followed by a rehabilitation phase. But if other injuries are associated with this, those usually need to be dealt with. A shoulder dislocation can be a big injury. It can take a long time to recover and get back to the activities that you want to do, but with the right team behind you, we can have a good recovery from this injury.